Hi, my name is Daniela. I'm going to be your nurse for today. Today we're going to do a CVC Dressing Change. Could you please state your name and your birthday for me? Secret Ions 5452. Alright, thank you. And do you have any allergies, such as to povidone, iodine, chloroprop, or latex? No, you don't? Alright, thank you very much. So today we're going to do the dressing change, and every hospital has a different protocol. So this is supposed to be a sterile, dry, occlusive dressing. So like this, for an example. And with a bio patch, like this one has a bio patch, we're going to change it every 7 days. If it does not have a bio patch, then you would change it every 3 days. It's the same thing for a PICC line. With a bio patch, you would change it every 7 days. Without a bio patch, you would change it every 3 days. And with the PICC line, what we would do is we would measure the catheter. So from the port to the proximal tip, we would measure the length of it to make sure that it's still the same length that it was before. There are other alternative dressings, such as sterile gauze, and that's used if maybe there's a lot of oozing blood, and that would be changed every 48 hours. So, I'm going to reposition the patient's head and then turn this way and ask for his cooperation during this time. I've lowered the side rail to help me out, and I'm just going to expose the part of the patient's area that is needed. Make sure that I provide patient privacy also. And everything here is clamped, and these are actually the positive pressure ports, so we don't need the clamps for them. Okay? So now I'm going to wash my hands and open my kit. The no-touch technique, like so. And I'm just going to put on my mask first and then put on my gloves.
If there was no blood that formed, that means I went too deep and I have to consult the physician. Probably start over. And I have a blab and I'm going to instruct the patient not to massage it. And if it's bleeding, I'll put a band-aid on it. And then I'm going to take off my gloves. I would dispose of the whole
just going to take off the dressing.
If there was a safety, I would throw a syringe in the shark immediately.
Okay, and I'm going to move it towards the front. Okay, and I'm just going to save this dressing for documentation.
Okay. Yeah.
And at this point, I just want to assess my site. I want to assess for any inflammation, such as any swelling, drainage, redness, if there's a smell to it. Hopefully there's not. And after I've done my assessments, then I will note them and then document it later. And I'm just going to remove my gloves and prepare to clean it. And so before this point, I would have cleaned my surface twice with chlorhexidine, just to make sure that I provide a good sterile field for this procedure.
Does it matter at which point I don't change the needle? Okay.
And I'm going to apply on my sterile gloves. Actually, I'm going to get my tape ready too, just in case I need it.
They're going to take me right there, right out, right time. They're also going to and then I would so it's your top. Making sure not to touch the top. And then I would clean both of them. And then I would make sure that with the medication I had the proper diluent for it. So in here it says 10 milliliters, so make sure that I have the appropriate size syringe for that.
And now I am sterile. So making sure that my hands are above my waist and that my sterile field is in my line of sight. Just gonna grab
I would also make sure I have the appropriate size needle.
and snap it, and I've already assessed for any allergies. So he doesn't have any allergies, so I'm going to clean the area for 30 seconds with the ChloraPrep, and I'm going to clean in just a circular motion. 30 seconds outward. Once. So I'm just gonna let that dry. I'm gonna throw this away. So after I let that all dry, I'm going to take my bio patch and I'm just gonna place the bio patch there. And now I'm going to apply the dressing on the Tigerden. So I'm going to leave about a 2-inch radius from the catheter site. Okay, and I'm just going to say this label. And write my name, my credentials, and the date and time that I did this dressing change. And then at this point I'm going to clean the catheter. So I'm going to take my alcohol swabs. And starting with the catheter furthest to me, I'm going to clean it in a one swipe motion, like so. And the middle, like so. And the one closest to me, like so. I want to make sure that I can also secure the catheters with another piece of tape, just to make sure that they're in place, and make sure that they're all clamped, and cover my patient up and tell him it's okay for him to turn his head now. Thank you for your cooperation. Make sure that he's comfortable before I leave the room, and clean up all my supplies and document all that I've done. Things to consider, such as high-risk safety concerns. If the port were open to air, or if one of the tips here accidentally got dislodged, then that would put the patient at a high risk. So what I would do at that point is I would clamp the tubing, I would call for help, someone else to give me an extra hand, and I would alcohol swab, and I would attach a new cap immediately because once air enters into the catheter, the patient is at risk for an air embolism, and that could ultimately end in death if not caught any sooner.